afternoon once again, and thank you for joining us for our daily virtual media briefings around COVID-19 with London City Mayor Ed Holder and the Medical Officer of Health and CEO for the Middlesex-London Health Unit, Dr. Chris Mackie. As a reminder, we welcome folks who are tuned in on Rogers Television, also Rogers Facebook, and the YouTube channel. We also welcome listeners to Global News Radio, AM 980 CFPL, who are joining us this afternoon, and those tuning in on the CTV London website. We will be with you for the next half hour, and a reminder to media who are joining us today to submit your questions in the question forum on the Teams platform, indicating your name and your media outlet and who your question is directed to. We'll now turn the meeting over to London Mayor Ed Holder. Mayor Holder.
Thanks very much, and welcome again today. So earlier today, as per London City Council's direction, our city staff produced a report to be considered at next week's SPPC meeting, which for the first time spells out COVID-19's financial impact on the City of London's budget. A few points, if I may. The report makes clear that the impacts of COVID-19 have challenged London like never before. As the city works to support frontline action and provide essential services, the financial implications to municipal budgets is unprecedented. Right now, even after a series of cost containment measures we put in place, we're looking at a financial impact of some $23 million by the end of June, and by the end of August, upwards of $33 million. And that final number could even be higher, but we don't have projections, frankly, beyond the summer. Let me be clear, despite these costs, essential services will continue regardless. These services are deemed essential for a reason. And that is critically important, that despite these unprecedented costs, we are not going to hike property taxes beyond those which have already been approved. That would be counterproductive. But through strong financial management, I'm proud to say this, the City of London is in a much better situation than a number of municipalities across the country. That certainly includes cash resources and reserves, and it should buy us some time to develop some longer-term solutions with our health community, for our community beyond the summer. I'm going to make sure we use that time to share vital information to our provincial and federal partners to secure the help to ensure financial instability of our city. Because as I've said time and again, no municipality can do this alone. In fact, though, let me give a shout out to our federal and provincial governments, because I think they work quickly to provide relief for individuals and businesses, because providing vital services at the local level has to be, and is to me, absolutely a priority. Now, also included in this document for Council's consideration are several immediate measures that could be undertaken by the municipality to assist London and to assist businesses. Several of these ideas are actually taken from the first summary report that we provided on the Mayor's Economic Impact and Recovery Task Force, as well as the Social Impact and Recovery Task Force. I'm hopeful that Council colleagues will give them their due consideration. And finally, that report includes additional measures that we intend to lobby and advocate on behalf of Londoners to the provincial and federal governments in the areas of maintaining our critical services, supporting our most vulnerable, and positioning London's economy for recovery. So I wanted to make that as a formal statement, and I appreciate extending some of the time I would usually use, because I thought it was important that as we discuss issues as they relate to community relief, that the public is aware of the report that we have produced. Thank you. Back to you, Dan. Oh, sorry. Back to you, Dr. Mackie. I apologize. Forget Dan. Back to you, sir.
Not at all, Mr. Mayor. Thank you very much for everything that you are doing and the city staff are doing. Been consistently impressed with the team on our early morning calls each day. And as a homeowner, thank you for doing your best to keep the costs that we bear in the community down as much as you can as well. Starting with our numbers, 9 cases locally, 1 additional death reported, 510 across the province. These numbers are continuing the downward trend that we've seen for several days now. The data is all sort of pointing in that direction. So the 510 cases across the province is in spite of the highest number of tests ever done in one day, over 10,000 tests done. in the last 24-hour period. And so the percentage positivity continues to decline there with those tests. And other indicators, the number of people in intensive care units with COVID is decreasing across the province, a trend that's been in place for about 2 weeks now. We're now seeing a fairly convincing trend downward in the number of people who are dying from COVID in the province as well. All of those suggesting that we have come off the peak, but disease levels are still continuing at relatively high rates, and physical distancing and closure of non-essential businesses is still important to get those disease rates back down to low levels. I want to highlight something today in the context of it being International Administrative Professionals Appreciation Day. So this used to be called Secretary's Day. The administrative professionals that we have in the health system have been an absolutely fundamental and crucial part of the response to coronavirus, whether it's entering data or setting up team meetings with Zoom or Microsoft Teams, or any number of roles that support the day-to-day operations of the health unit and other healthcare sector partners. Administrative professionals are absolutely crucial now, as they have always been. So a big thank you from myself to the administrative professionals in the Middlesex-London Health Unit and across the health system who have been a part of this response. That's it for me, Dan. Happy to take questions.
Thank you very much, Dr. Mackie, and thank you, Mayor Holder. We do have a few questions lined up, so we'll get to those right away. The first, Dr. Mackie, is for you. It is from Dan Brown at the London Free Press. Dr. Mackie, are we at the peak of COVID cases in London and Middlesex? What can we expect as we're on the downward slope of the curve?
Well, first of all, are we at the peak? Yes, I would say we are at potentially past the peak. Because our numbers are smaller than the provincial numbers, they are bouncing around a little bit more. We saw particularly high numbers when the province was processing the backlog of tests. So in those days, about 2 weeks ago now, where there were many more tests being processed than usual, we saw very high numbers there in the 20s. Since then, we've seen a couple of numbers that were above 20, but not many. And now being below 10 today for the first time in some time is very reassuring. So all of that combined, as well knowing about the hospital capacity and intensive care unit beds being used in the region, it looks like we are at or past the peak. What can we expect from here is a long, slow burn at these relatively high disease rates. This is not an outbreak that disappears overnight. It's something that will be with us for the coming weeks. And so we absolutely need to remain vigilant, continue to practice those distancing methods, and respect public health measures as much as possible. And if we're able to do that, then it will be within a few weeks that we can say that this pandemic wave is really behind us.
All right. Thank you, Dr. Mackie. And Dan has submitted a follow-up question, and you were talking about the numbers declining in the last few days. Dan is asking, do you expect the peak to be more of a plateau with a very gradual descent in new cases?
Yes, and I'm just going to screen share here for a moment. This is publicly available data that is on an independent third-party website that shows intensive care unit cases in Ontario and hospitalized cases in Ontario. The reason I like the intensive care unit cases in Ontario is that it's very unlikely to be susceptible to the variation that a whole bunch of other data sets that we have is susceptible to. So for example, if we happen to do more testing in the community, it won't change the ICU rates. If you made it to intensive care unit, chances are you've been tested for just about everything that could put you there along the way. And so when we're pushing to increase testing, you won't necessarily see a change in the number of people in ICU that are testing positive. Whereas even in hospitalized patients, when we had to ration the tests because of swab supply issues, that meant that some people, even in hospital, weren't necessarily getting tested. So if you see the graph on the right here is hospitalized patients. And over the last few days with the push and increased tests, you do see the number of people diagnosed in hospital going up. Whereas in the ICU, where that push to increase tests won't have an impact, you see that we've been flat at high levels for really almost 2 weeks now. Actually, that is 2 weeks that we've been on fairly flat at high levels and declining. That's most likely indicative of what is happening in our community. And it's actually probably that the peak was even before the peak in the ICU cases that you see here, because it takes time to get sick enough to get into ICU. So it's likely that the peak was very close to the beginning of April. So this is this sort of trend that we would expect. I think it's a very indicative trend of what is happening in the community, high levels and slow, long decline. And certainly that's what other countries that have been hit earlier than us did demonstrate in their data.
Well, thank you very much for that, Dr. Mackie, and thank you for sharing those graphs as well. Mr. Mayor, the next question is for you, also from Dan Brown at the London Free Press. Mr. Mayor, have you been in touch with the province as far as the conditions under which, for example, businesses would reopen?
I haven't. In fact, I will tell you, my discussions with ministers at the provincial level is almost on a daily basis. And at this stage, I think what you've heard from the Premier is that, and he is the primary, as you'd expect, the primary spokesperson for this. He is optimistic, but he is not at a point where he is prepared to change the rules around what has been deemed to be essential services. Look, you'll know, Dan, that he's done this twice. He made his first announcement about what was deemed essential, then came back and revised that list, making it a little more restrictive at that time. And that goes back now 2 odd weeks. At this point, it's premature. You'll know that the Premier has announced that we have that we have emergency measures in place until May 12th. That impacts everything from education to new construction to a variety of services, the stay-at-home orders and the like. And we as a municipality, as all municipalities in the province, are guided by those directions. So at this point, we do not know when. One thing, though, that will be absolutely paramount, and this is where I'll be working very closely with Dr. Mackie, we will do nothing in London, Ontario, unless we're absolutely confident that the interests and health and safety of Londoners is paramount. And that's where I look forward to my continued connectivity with our Director, Medical Officer of Health, as we look to see what's in the best interests of our community. This community comes first, irrespective of any other direction, and that's absolutely clear. I look for some feedback that we always do with the province and the Premier. At this point, I don't see it as a short-term response that things are, quote, normal. I would come back and suggest to you there will be a new normal. I just can't tell you when the day is.
All right. Thank you very much for that answer, Mr. Mayor. We have one more question, and if we don't have a lot of other questions coming in, we can probably adjourn a little early this afternoon. So this question, Dr. Mackie, is for you. It comes from Grant Demi at MyFM Radio in Strathroy. Dr. Mackie, the Premier is calling on the federal government to get Canadian Forces personnel in 5 long-term care facilities immediately. Do you think this request should have come sooner? And can you see a scenario where Canadian Forces are implemented in more avenues?
Yeah, so the question about deploying Canadian Forces to long-term care homes, first of all, I find it very reassuring that we have the Canadian Forces there to draw on if and when they're needed. We have one of the most professional and respected armed forces in the world, and having them, if needed, is much appreciated. That said, there are lots of other places to draw from before needing to draw from the armed forces. Right now, our hospitals are sitting at about 60 to 65% capacity, depending on the day. That means there are dozens and dozens of staff that could easily be redeployed there who have the experience needed. So that's definitely something that is happening, and that's what's happening here in the London and Middlesex regions. That would be the sort of the first point of contact for additional staffing resources prior to going to outside of the healthcare system. The other thing that this does bring up is the new provincial directive to test everyone living or working in long-term care homes. This is actually an enormous directive. It probably means about 80,000 people across the province, give or take, and it will take certainly weeks to complete, potentially more. It will give us a much better picture of what is happening in our highest risk community settings in the long-term care homes. And it will also be an enormous draw on the resources from long-term care homes, from healthcare, from the hospital lab system, from hospital staff to support that work, and from public health in terms of follow-up. There is a risk here, of course, and that is around staff having to be off, and already the system there is quite stretched in terms of staff. So we're working with the hospitals and the rest of the healthcare system to look at how do we support those homes, as new outbreaks will certainly be declared because of this testing, and staff having to be off work because of this testing, to make sure that the long-term care home system is as supported as possible as we go through this.
All right, thank you very much for that answer, Dr. Mackie and Mayor Holder. We don't have any other questions in the queue, so I think what we'll do, if either of you or both of you would like to make a closing statement, and then we'll sign off for the day and come back tomorrow. How does that sound? Does that sound all right? Yes, all right. So Dr. Mackie, why don't we go to you first, and then Mayor Holder, we'll get you to close the briefing right after that. Dr. Mackie.
Well, I think the first thing that I would say is how exciting it has been to see the healthcare system really come together as a system, more so than ever in the past. We're well positioned coming into this with Ontario Health being created, which had the explicit mandate to take many different healthcare partners and create a system out of them, and that really has been accelerated because of the absolute need to be working together. So that's been great. So many very impressive colleagues in the hospital system, in the primary care system, and across the healthcare sector. And it's been a pleasure getting to work with them. Also, can't thank you enough in the media and through you to the public. It's only because of the strong distancing measures that we've all been practicing that our hospitals have not been overwhelmed. We've seen ICU capacity here at somewhere around 20 to 30%. ICUs in places like Italy, which has 4 times the ICU capacity as Ontario, were overwhelmed by coronavirus. And that's, we kept those hospitals and ICUs running because we in the community did the things we needed to do to protect ourselves, our families, and our friends and community. So big kudos to you. We are not done. Can't emphasize that enough. We've still got weeks to go here, but we're on the right path and we're doing it together. Thank you.
Mr. Mayor.
Thanks very much. And I'd like to echo Dr. Mackie's comments about the health community and how it's come together in a very thoughtful way, and I think in a very collaborative way as well. And I think that is the piece that has truly struck me. And as he has talked about the support of those unsung heroes, those individuals who come in daily and put the statistics together, I think of the report we've just presented here, and that doesn't come without tremendous labor and effort. And this has truly all been a Team London approach so far. So we are not going to stand, we're not going to stand on the deck of the ship and say mission complete. What we are going to do is we're going to say we're in this together. We're continuing to do this together, and that's why I'm so grateful for the cooperation we've had with the Middlesex-London Health Unit, and why we've had such great support through council and our own administrative staff to make this work, and of course the support of our community. When I was asked earlier about the issue in terms of the Premier and what would happen with respect to business and the economy, just want to be absolutely understood on this. And that is, while I get the rush to want to reopen the economy, I will also say we will not ever do it at the expense of human life. That's too precious. So with that, let's maintain and keep the optimism going as expressed by Dr. Mackie. I'm certainly hopeful as well, and say thank you to him and his team for the great work they're doing, and thank the media for their great interest in carrying this message forward.
And thank you very much, Mr. Mayor. Thank you, Dr. Mackie. Having no other questions, we will take an early exit today, and we look forward to seeing you tomorrow for our daily media briefing at 2 o'clock on Thursday afternoon. Have a great rest of the day.
Thank you.